When we do our nursing assessment, when we first walk into the room, what we're going to assess firstly is the skin, the integumentary system. And to start that assessment, we're really just going to inspect. We're going to look at the patient's skin. And I want you guys to be aware, and I want you guys to remember that you need to remove the robe. You need to look at all of their skin and be very professional about it. Say, look, I'm going to inspect your skin. Let me just look at your stomach. Let me look at your back. Let me look at your butt. I want to see everything, you know? And you just let them know in a very professional manner that that's what you're going to do. That's your job as a nurse. All right, so the first thing we're going to inspect is we're going to inspect the color. Is the color appropriate for their race? Do we want to see the moisture? Are they diaphoretic? What's going on as far as moisture? Are they really dry? Are they diaphoretic? Are they sweating? What's going on there? Then we want to also inspect hair. Do they have hair where they should have hair? And do they not have hair where they shouldn't have hair? Especially kind of on the legs, looking for circulation and things like that. We're going to look for any rashes. Are there any visible rashes? Going to look for lesions. And with that, again, it's very important that you remove any clothing and you look all around to visibly see any sort of rashes or lesions. And then we're going to look for pallor, and we're also going to look for edema. This is where we can really look for visible edema. Do we notice any signs or any locations where there's edema on the patient? Once we've inspected it, then we can palpate. Firstly, we're going to palpate for temperature. Okay, as we place our hand on the patient, what's their temperature? Are they really warm? Are they really cold? And we can just get that really quickly. We're going to look for turgor. We're going to look, does the skin tint? Does it return to the way it should? We're going to look again and look at those lesions. We're going to palpate the edema. Remember, we're going to grade the edema. We're going to press and give it a quality. Does it, is it +1, +2, +3, +4? Is it pitting? And what's the quality of that edema? Then we're also going to palpate for texture. Is the skin really rough? Is it smooth? Is it moist? And that's kind of how we do our general integumentary assessment. Remember, we're doing a head-to-toe assessment, so I want you guys to simplify this. I don't want you to overthink what's happening here. After we've inspected the general appearance of the skin and our patient's general well-being, we're doing head to toe. So simply start at the head. And what we're going to do is we're going to look at it, okay? We're inspecting again. We're inspecting the shape, the symmetry of the head in general. And then once we've inspected it, once we've seen, is it shaped the way it should be? Is it symmetrical? Then what we're going to do is we're going to palpate, okay? When we palpate the scalp, we're looking for tenderness and any deformity, especially in an adult patient. We don't want to find any tenderness there. Once we've done that, we can move on to the nails, okay? We're going to look at our patient's nails on all four extremities, hands, feet, and we're going to inspect them. Is there clubbing going on? What's the color of them? Is there any cyanosis? Then we want to press on it. What's the capillary refill? Is blood returning as it should? And that's really all we're going to do for the nails, okay? Once we've done nails, then we're going to do our patient's head, okay? So to do the head, we want to look straight on with the patient. And again, we're inspecting here. What's the symmetry? What's the size? Is it appropriate for the size of the patient? Okay, and then is it uniform? Are eyes where they should be, nose where they should be, mouth where it should be, ears where it should be. From there, we're going to go on and we're going to inspect the neck. Okay, here's my patient's neck. And again, we always start with inspection. So is it symmetry? Are there any lesions? Are there any scars? As I look at my patient's neck, looking all around. Then what we can do is we can palpate. Okay, we want to palpate the neck for tenderness. And a lot of times what we'll do is we'll come around here, and what we're going to do is we're going to be assessing the lymph nodes and the thyroid gland, and we're looking for TMJ as well. So we'll have them open their mouth and close it, looking for TMJ right here, assessing the lymph nodes and the thyroid gland right here, having the patient look. Then we can do our patient's eyes. We'll look again right at the patient, and what we want to see here is we're going to inspect the interior and the exterior of the eyes. We're going to inspect all their visual fields and have them look, and we're also going to check their reflexes. Okay, are they able to see in all their visual fields? From there, we can inspect our patient's ears. All right, again, starting with inspection, we want to inspect color, shape, symmetry, and we want to then look inside. Okay, we can have we can look right inside the patient's ears, and we're inspecting the bones inside the ears. We're inspecting the eardrum. Then we're going to palpate. We're going to palpate for any tenderness on the patient's ears, and palpate for any sort of deformity. Okay, is the targus, the pinna, is everything where it needs to be, and are they having any sort of tenderness with that? Now, after we've done that, we're going to move on to our nose. We're still in our face, right? We've done our eyes and our ears. We're going to go to our nose now. And again, we always start with inspection. We're going to inspect the shape. Is it symmetrical? And then we can do an interior inspection. We can look right into the nose, and that's going to allow us to start looking at the sinuses. Okay, we're going to inspect the frontal sinuses, we're going to inspect the maxillary sinuses, and see if there's any sort of swelling going on with our patient's sinus. Then we're going to do a thorax and lungs assessment. This is where things start getting a little bit more involved. All right, what we're going to do first is we're just going to look at our patient. We're going to inspect the respiratory quality. Are they breathing? Does their chest fill symmetrically? Is there any sort of tracheal deviation? Okay, so does the trachea move over to one side, which could be a sign of like a pneumothorax? And then we also want to just inspect generally, what do their lungs look like? Okay, on the back as well. When they breathe, does it expand as it should? That's how we inspect it. Then we're gonna do our palpation. We're gonna inspect for any tenderness. Do they have any tenderness when we press around on the lungs, on front or back? And then we're gonna listen for fremitus, and we're gonna also press for chest expansion. We can put our hands on back here and see, do our hands move out equally when the patient breathes. Then we're obviously going to do our auscultation. We're going to listen in all of our breath sounds as we move across the front. Then we're also going to move across the back, listening for our bronchiovesicular sounds as we move around on our patient, and that's our auscultation. Okay, once we've done that, we're really starting to look at our patient's breathing. Now we can move on to our heart and our great vessels. When we do that, one of the things we can look for is our jugular venous pulse. We're looking for, does the patient have a visible pulse? We want to feel all around for all the different pulses. Okay, and that can take a minute, and you might need to let your patient know that you're going to be turning. They need to lift their arms. You're going to need to be feeling around to get a sense of all these pulses. Then we're going to listen for our heart sounds. We've talked about heart sounds a lot before, but the mnemonic I like to use is ape to man. Aortic, pulmonic, Erb's point, tricuspid, mitral. So we're going to listen for the valves in these different locations to allow us to hear that the valves are working, that the heart's pumping as it should. Now we can move on to our peripheral vascular system. We've kind of done some of this in our general integumentary check, but what we want to do is we want to look at the patient's color throughout their entire body. What's the color of their skin generally throughout the entire body? Is there any edema? We want to feel the temperature throughout the body, make sure temperature's equal on both extremities, on both sides of the body, and then palpating also that edema and giving it a number, giving it a grade, so that we can then report that to providers and to other nurses. Okay, now we can move on to our abdomen. With our abdomen, things start to get a little bit more involved here because there's a lot that we're looking at here. We're looking at a lot of different organs and we're assessing a lot of different things. So first with our abdomen, what we're gonna do is we're gonna inspect. Okay, we're just gonna look generally at the patient, inspect for uniformity. We're gonna ask about discomfort. We're gonna look for any sort of color. Do they have any bruising or anything around the umbilicus? And we're going to look for any scars. We're gonna look for any hernias that we can see. We're gonna see if we can see peristalsis. We're gonna also look if there's any pulsations. Can we see an abdominal aortic pulse, which, in a skinnier, smaller patient, pediatric patient, that wouldn't be such a big deal. An adult patient, that could obviously be a sign of things that we need to look further at. Then we're gonna move on to auscultation. Remember, with abdomen, we inspect, then we auscultate before we palpate or percuss. We don't wanna get the peristalsis moving. We don't wanna interrupt the bowels. So we inspect, then we're gonna auscultate. We're gonna listen in all the quadrants of the abdomen, listening for bowel sounds. And then we're gonna give, again, a quality to that. Are they active, hypoactive, hyperactive? What's the quality of the bowel sounds? Can we hear? We wanna listen up to a full minute in all the quadrants to see if we can hear anything. Okay, once we've done that, we're going to start percussing. We're gonna percuss in the 4 quadrants. And again, what we're doing is we're giving it a quality. We're gonna percuss over the liver. Can we hear the liver? And then we're also gonna look for any sort of renal tenderness. Does the patient have any tenderness where the kidneys would be? And then we also wanna palpate for the spleen. Okay, we can palpate the spleen. We can palpate the liver. And we're just really trying to fill all these different organs here to see if there's any sort of problems. Remember, that's what we're looking for, is are there problems, okay? We want everything to be normal, and we're looking for problems. Is the liver enlarged? Is the spleen enlarged? And that's kind of what we're looking for in our patient as we do these things. Then we're gonna do palpation. We're gonna go light to deep, okay? We're gonna go light and then push deeper on our liver, our spleen, over our abdominal aorta, and then we're going to look for rebound tenderness, and then we can also look for a fluid wave in our patient for ascites. So there's a lot of different things we're looking for here, and I want you to dig in deeper to this one because this one can be obviously much more involved in the rest of the module. And then musculoskeletal. So again, a lot of this we'll find in our initial inspection of the patient, but with our musculoskeletal, we're looking for asymmetry. Do both arms look the same? Do both legs look the same? Is there any asymmetry with our patient? Is there any deformity? Is there any atrophy on one side, one limb, one portion of the body? We're going to start palpating major joints, looking for tenderness, looking for deformity. Then we're going to start doing our range of motion exercises. Can the patient move their arms as they need to? Can they move all their other joints as they need to? Can they move their neck as they need to? Is there any sort of tenderness? Again, looking for deformity, looking for abnormalities. Then we're going to go along and we're going to do our neurological exam. And this can kind of be happening as you're going. You're talking to your patient, you're asking them their name, asking them who the president is, big things that everyone should know. What's the date? What's the time? What's the location? So this should really be gathered as you're going. But when we do our neurological exam, we're really just kind of getting that general, are they alert and oriented to place, time, name, location, all those different things. And then we can give them alert and oriented status to the other providers, to the nurse. And we're also going to, as we do that, check our cranial nerves. Part of that's going to be, doing our pupillary exam. We're going to do facial. We're going to test, can they feel hard, soft? Can they squeeze? We're doing all those different things. Are they coordinated? What's their movement? We're going to test their senses. Can they smell? Can they hear? And again, a lot of this is happening as you're going. As you're checking the skin, you kind of have your patient squeeze your hand with both hands. And so that's kind of how you're going to do that. And then we're going to palpate motor strength. Have them grab your arms and try to pull your arms away from you. Checking muscle tone. Are they strong? What's their reflexes? We can start to test all the different reflexes and again, the senses. Then we're going to do our genitourinary exam. What we're going to do here is really getting a little bit more personal with our patient and assessing that. We want to know, does everything look normal? So part of that is assessing genitourinary status and that the general appearance is fine. There's no lesions, there's no scars. And we can palpate here. We can do a breast exam. We can also do a testicular exam, prostate exam, vaginal exam, pap smear. Those types of things are going to be going on here. And just, again, looking that everything is as it should be, or are there any abnormalities? And as a nurse, you're going to be personal. You're going to get in people's space, and you're going to find things that, you wouldn't see in normal life, okay? Then we can assess our lymph system, and really we're going to be palpating all of our lymph nodes. So you guys, this isn't a complete exam. What I wanted to show you guys here is kind of how you do it. And I want you to use the rest of this module and the rest of this course to really get an idea of how to do a more thorough exam and what you're really going to be looking for. Okay, so the text below here is going to really dive into everything that you really need to know and everything that you really need to do. And this was just a quick thing. You walk into the room, you start talking to your patient, you're doing your general inspection, you're doing your mental health exam. Then you start assessing the head, you're assessing the neck, lymph nodes, you're assessing the trachea, and you're moving down as you go. Heart, great vessels, lungs, stomach, musculoskeletal, hair, skin, everything, just as you're going down on your patient. And this really, you'll start to get more and more comfortable with this as you practice. But I want you to just kind of relax as you do it. I remember my first health exam test in college or in nursing school. I was freaking out. I was terrified. I ran through it so many times in my mind. I visualized it mentally. And what really helped, guys, was just to realize it's a head to toe exam. And it's called that for a reason, because as you go head to toe, you're assessing one thing after another. So go ahead and make sure you read below, read all this stuff, and then you just relax about it and realize that you're assessing your patient.